I want to take you back to one of your old jobs as New York City Health Commissioner and take us into what you would be saying to the mayor, to city officials today about what you would need to reopen New York City public schools. And I ask that because so much else in the economy is dependent on the schools opening. Would you need, for example, the ability to test all students or test all faculty members whenever necessary?
Well, we need to still learn about the nature of this virus and the risks for spread and how best to contain it. We have come to understand that children are less at risk in terms of symptomatic disease and all the many complications that can come with infection. But we now understand that they can be asymptomatic carriers. What we don't know is how much they are bringing that disease home to others in the household or spreading it in the community. So we need to continue to deepen our understanding. So that's one thing. We have to look at the experience of other countries. We have to look at places that are starting to open up their schools and also return to other kinds of larger scale gathering settings and continue to learn. We can't give an answer tomorrow whether the school should open up in the fall. We simply don't know enough. But we need to have more testing. We need to make sure that we have the systems in terms of public health to follow up, to be able, after we test and identify those who are infected, to isolate them, to do contact tracing and quarantine of those who've been exposed to make sure that they aren't sick. And we need to be thinking about how we will reconfigure certain of our settings, like schools, in terms of, are there ways to make them less dense, to maintain social distancing to some degree or another. And I think, it's going to be very, very hard at the younger ages to maintain social distancing. It's sort of the opposite of what school is all about. And it's probably a false hope that kids will wear their masks and wash their hands enough and everything, but we have to start building in those new behaviors. Going back to school for college age, I think it's going to be a bit easier because much of it can still be done online and you can distance in classrooms, et cetera. But these are complex questions, and I don't envy my colleagues working at the local level in terms of public health. But I think it also goes to the fact that we need more guidance at the federal level, working with state and local health departments so we can have much clearer guidelines and more consistency of message.